Hey everyone, welcome back. Today we are tackling an essential topic in medicine, which is the outpatient management of community-acquired pneumonia. So we're not just going to list a bunch of medications in this video, but we're going to try to make it fun and memorable with some mnemonics. So first, let's go over this flowchart I have over here. So in this flowchart, we have the outpatient treatment for community-acquired pneumonia. So we first get to the determination of treating the patient outpatient by using these two scores, the pneumonia severity index, also known as PSI or curve 65. So once we plug these values into an online calculator like MedCalc, we can determine if the patient can be treated in an outpatient setting. And so the outpatient treatment, the first question that we're going to ask is if the patient has comorbidities or risk factors for resistant pathogens. So if they have any chronic heart diseases, lung, renal, or hepatic disease, if they are immunosuppressed, like having diabetes or some malignancy, or if they had treatment with IV antibiotics in the past 90 days, that can also tell us that they might be resistant to pathogens. So if the answer to these questions is no, then we can do a monotherapy with amoxicillin, doxycycline, and a macrolide. If the answer to this question is yes, then we can do a combination therapy with one beta-lactam and a one macrolide, or we can just do a monotherapy with a fluoroquinolone. So now let's go over the mnemonic that we have. So imagine you're at the CAP Cafe, the community-acquired pneumonia cafe, where the treatment options for community-acquired pneumonia are served up like meals. Depending on the patient's condition, they'll choose one of three orders: a dull meal, a Big Mac combo, or the fancy flora. So first, we have patients with no risk factors. Their treatment is straightforward, just like ordering a dull meal. We call this a dull meal. So the A is going to be for amoxicillin, D is for doxycycline, and the M is for meal or a macrolide, which can be azithromycin or another macrolide if resistance is low. So this approach is basic, it gets the job done, and is perfect for patients without complicating factors. Now let's talk about the treatment options for patients with comorbidities or risk factors for resistance pathogens. They need something more substantial, like the Big Mac combo. B is for a beta-lactam, such as amoxicillin clavulanate or cefuroxime. Mac is for a macrolide, like azithromycin or clarithromycin. And this combination is a satisfying two-item treatment plan for a community-acquired pneumonia in these patients. Some patients with risk factors might prefer something solo but powerful, and here we can enter the fancy flora. And this meal is a high-end option. Let me move my face so you can see. So this meal is a high-end option representing the respiratory fluoroquinolones like levofloxacin or moxifloxacin. It is a complete standalone dish for outpatient management of community-acquired pneumonia. So let's recap the menu we have at the CAP Cafe. If the patient has no risk factors, they get a dull meal with amoxicillin, doxycycline, or azithromycin. If they have risk factors, they can order the Big Mac combo with a beta-lactam and a macrolide, or they can go for the fancy flora, a single-agent respiratory fluoroquinolone. So that is the mnemonic I have for the outpatient treatment of community-acquired pneumonia. Hopefully this mnemonic helps. Thank you for your time.